Good morning, Peter Goertz. I'm a psychiatrist. Bad girls and boys. What made me talk about this today is I saw a patient who'd been, as a child, sexually abused and seems to have dissociative identity disorder, and behavior that she showed as a child might have been labeled as, quote, bad behavior. And I'll give you my thoughts based on my experience as a psychiatrist and my opinions. I myself, as a child, was exposed to some neglect, and I was a very angry little boy. I was fighting, stealing, and at one point I was put in a different class because of behavioral problems. Now, labels are superficial. We don't want to judge, in my opinion. In general, whatever the behavior is, even if it's something that really can be very distasteful to you, let's say cruelty to animals, there's in general a reason for that behavior, whether it's fighting, stealing, like I said, cruelty to animals, running away, promiscuity as a teenager. And I'm not trying to make an excuse for behavior that's unacceptable, like stealing. But what I am saying is, in general, there are roots to such behavior, in my opinion. And kids who show those behaviors can benefit from mental health treatment. We want to, if at all possible, offer them mental health treatment. And the roots that I'm talking about can be physical, sexual, or emotional abuse, neglect in childhood, head trauma can contribute. And these kids are at risk for further instances of being abused, and also seem to be at higher risk for abusing other children. There's a risk of head trauma because of fights or other risky behavior. There's a risk of incarceration, getting involved in the criminal justice system. And as adults, so-called bad girls and boys, when they grow up, can have various psychiatric problems, mental illnesses, depression, anxiety, PTSD, dissociative identity disorder, alcohol or drug use. They're at high risk for that. And also, in my experience, and maybe this is related to chronic stress, in my experience, they're also at high risk for physical illnesses, various physical illnesses. And children, so-called bad children, or adults who've been bad children, may have behaviors that provoke anger in us. They may try to provoke anger in us, in psychiatrists or other people who treat them as mental health professionals. And we want to avoid treating those patients unfairly, and we want to avoid judging them. And we want to do our best to try and understand where they're coming from, and at the same time, set clear and firm boundaries, which of course is not easy. Thank you very much.